Thank you. Good afternoon, everyone. First, on behalf of the Agency for Healthcare Research and Quality and the Department of Health and Human Services, I want to commend the World Health Organization and the World Alliance for Patient Safety for the Safe Surgery Saves Lives initiative, as well as for all of the organization's other global efforts to reduce deaths and complications in surgery. I wish you great success, and I'm confident that you will have great success with the surgical safety checklist. I think it is the type of easy-to-use tool that clinicians can and will be excited about using to improve the safety of their operations. I want to spend just a couple of minutes talking about another system here in this country that has actually had exactly that effect, and why I am so confident that this initiative, too, will be very successful. This initiative is called the National Surgical Quality Improvement Program, and actually began addressing a very similar need in our Veterans Administration health system in the mid-1990s. Ultimately, this NSQIP, the National Surgical Quality Improvement Project, became the basis for the Surgical Care Improvement Program, which is now in place and in residence at all hospitals in this country. How this got started was our Congress passed a law directing the Veterans Administration to do something like this in 1986. And by 1994, this was up and running. And suddenly, for the first time, surgeons could systematically see regular reports about how they were doing, unanticipated and unexpected adverse events, and they use the information to improve, to reduce complications, and to save lives. In 2001, shortly after the Institute of Medicine report to err as human, the Agency for Healthcare Research and Quality actually gave a grant to the American College of Surgeons. The PI was Dr. Sharkey Corey, to actually take this same system and use it in civilian hospitals. And since then, I don't really have words to tell you how excited the people are who participate in this project. This is not just surgeons, it's perioperative nurses, it's all of the healthcare workers whose efforts are absolutely indispensable to making sure that surgery is performed as safely as possible. Ultimately, this effort became the foundation for the Centers for Medicare and Medicaid Services, or CMS, to create the Surgical Care Improvement Project. Today, that partnership, which includes 10 national organizations, is to reduce the incidence of surgical complications by 25% by 2010, and it's already had an impact on reducing surgical complications. In addition, in this country, we've also seen leading and very important efforts by the Society for Thoracic Surgeons. So I know that around the world there is going to be enormous interest in surgeons working together and working with the World Alliance under Dr. Gwandi's leadership to make sure that the surgery they do is as good as it can be and as safe as it can be. So let me say that I'm going to close with a quote from Yogi Berra, a very famous baseball player in this country. And he once said that in theory, there is no difference between theory and practice. In practice, there is. What the 20-year effort that we've seen in the States can and does demonstrate is that a systematic focus on making surgical care safer can pay huge dividends for our patients and actually dramatically improve patient safety. So we are really thrilled to be with you today at the launch of this important initiative. Thank you.